Thank you for this opportunity to give this talk. I'm a professor in statistics and computer science at Harvard. You should see this first slide. This slide has small icons that denote some projects that we've been involved in. We've been very fortunate to be involved in a number of digital health projects. Today, we're going to use HeartSteps, a particular digital health project, to make the ideas clear. You'll see them as we go along. So I don't have any conflicts of interest to disclose. My goals from an educational perspective are to help people have a high-level understanding of micro-randomized trials and how we can use them, to have a high-level understanding of an AI method called reinforcement learning and how it can be related to personalizing digital health interventions, and to think more deeply about what we mean when we say personalization. I'm fortunate to have many collaborators. I have pictures of many of the collaborators here. These collaborators span the engineering field, the computer science field, the behavioral science field, health science, and in particular, Peng Liao is the person who developed the AI algorithm that we'll see later. So first, I'll give a brief introduction to mHealth, just so that we're all, everything is clearer. So there's two types of treatments that one encounters when you're thinking of delivering treatments with a mobile device, such as a smartphone, an iPad, a wearable. One is called a pull. This type of treatment is always accessible, say, on one's smartphone. For an example of this would be someone who's struggling with alcoholism, and they could go to their phone and learn where the nearest in time and geography meeting of Alcoholics Anonymous is, so they can attend. So pulls help people, they allow the individual to realize, well, I need help, so then I go to the smart device and I access that help. Unfortunately, often people who are struggling with chronic disorders, as you know, often find themselves in very difficult situations. Maybe they're experiencing a lot of craving, a lot of stress, or their environment is not conducive. In these settings, it's difficult for them to recognize that they need help. So this is where pushes come in, and the great promise of a push. A push is where sensors on the device, a wearable, indicates that the individual might be able to benefit from a treatment, and so the device reaches out and attempts to deliver that treatment. So this is great because you can help someone, potentially help someone, even when they don't yet recognize they need help. The downside of this is that with a push, it's easy to interrupt people as they go about their life, and that is extremely aggravating. So this is exactly the kind of setting, that is with pushes, that you want to experiment, because you only want to deliver a push when it really is helpful for that individual. So when we talk about personalization, some of the questions we're asking: when is it most useful for the digital device to initiate contact with the person to provide help? Should the type of help vary based on where the person is, the weather outside, if the person is at work or at home, it's in the evening, how the person feels? Do the answers to these questions change as a person's experience with the intervention grows, or as their circumstances change? So it could be that early in treatment, one type of help is most useful, whereas later in treatment, another type of support is most useful. So by help and support, I mean different types of cognitive interventions that help people rethink their situation, stress reduction exercises, small interventions that provide some social support, motivational interventions. These are all the types of help that we're talking about here. As you can imagine, all of this combines a variety of health sciences, as you see from the last part of this slide. So in Heart Steps, this is a series of 3 studies for individuals who have stage 1 hypertension. Stage 1 hypertension is a unique opportunity, presents a unique opportunity. The individual does not yet have to take medication, and there is a good chance that if they're able to change their diet, their physical activity, their management of stress, they might be able to prevent ever taking medication. So the idea here is to build this coach, and in this case, we're focusing on the physical activity to help that person improve their health so that they don't have to go on medication. In the first study, a 6-week, 42-day study, we had one tracker on their wrist, and then there were this tracker, the wearable band, had measured step count, minute by minute step count, and then there were a number of sensors on the smartphone as well. And we also collected information about nightly information on that individual's perceived stress, their burden from the intervention. 2 of the questions we were really interested in is, how could this smartphone help you plan your physical activity tomorrow so that you'd be better able to enact it? And in which context or state during the day should the smartphone ping, light up, and attempt to provide a contextually tailored activity suggestion that you could use at that moment? I'll show you examples shortly. So the first study is a micro-randomized trial, the 42-day study. So what is this? This is a study that's used to provide data for constructing or building a digital intervention. So it's not going to confirm that the whole digital package is better than some control. It's more for constructing that digital intervention. On each individual, one randomizes the delivery of the intervention or treatment each time that intervention might be delivered. So as we're going to see in the case of activity suggestions, this is multiple times per day. The result is each individual is randomized many times during a study. So in the case of the first study, the 42-day micro-randomized trial, the activity suggestions were randomized at 5 times per day. These were person-specific times, that person's morning, midday, and so on. And the activity suggestion would be delivered 60% of the time, so around 3 out of the 5 times, and no suggestion at all would be delivered the other remaining time. Also, every evening, the individual might be was randomized to support planning for physical activity the next day, and that randomization was 0.5, so that around half of the days they'd be prompted to plan physical activity on the next day. So here are some screenshots from the app. On the right side is the contextually tailored activity suggestion, and you see 2 examples there. The example that's on the far right is not very burdensome at all. This one came on a work day in the mid-afternoon, and you see it doesn't take much time at all to try out. The activity suggestion that's a little bit to the left is more about taking a walk that might take 3 to 5 minutes. So it's a slightly more burdensome suggestion. Then if you go to evening planning, there are also 2 ways to help someone plan their physical activity on the following day. The approach that is slightly to the right gives you, the individual, a list of ideas that you yourself had already suggested or already used in the past, and you just checked the one you wanted to use. Very easy. The evening planning on the far left was much more onerous because you had to type out your plan, more burdensome. So in each case, you could get a suggestion or not. If you got a suggestion, it might be more or less burdensome. And the same goes for evening planning. We're going to focus on the activity suggestion, and we're going to focus on whether or not to deliver that suggestion. If the suggestion is delivered, then it's either going to be a 3 to 5 minute suggestion or a very brief suggestion. Again, you see an example. This one came early in the morning. It was a very cold day. The content of the suggestion is tailored to the weather, the fact that it was in the morning. It was a work day. You can see the language for that. These suggestions, contextually tailored suggestions, are delivered an average of 3 times per day. So what's the goal here? The goal is that these activity suggestions should be useful to the individual in the setting they're in right now. So the outcome is the step count in that subsequent 30 minutes. So very momentary outcome. And the overall idea is that when you combine activity suggestions with other types of interventions, you should, that will help that individual build up a set of ideas for how to be more active in life. And then over longer time periods, with, again, including other types of interventions, contribute to a reduction in heart attacks. So I want to mention that activity suggestions are only delivered at any particular time if the individual is available. And this is a critical aspect here that, for example, if sensors indicated that the individual might be operating a vehicle like a car, then we would not, under any circumstances, deliver an activity suggestion. I have in blue is walking. All of these activity suggestions were for a different new walk, a new activity. So if the individual is already walking, we don't want to interrupt them and suggest they change their walk. So only if individuals are available are they randomized at a particular time. Again, this could happen 5 times a day over 42 days, so 210 times. When we were designing this micro-randomized trial, we anticipated that these activity suggestions, they do interrupt people as they go about their life. One might be concerned that they're going to be aggravating. Another issue is that these activity suggestions, because it's repeated stimuli, we know from psychology that if you deliver a series of repeated stimuli, you can get habituation. And habituation is where someone just does not see the stimuli. They don't feel burden, they just don't see the stimuli. So when we were designing this study, we drew this little graph on the bottom right corner. There's 210 decision times, 5 times a day, 42 days. That's the horizontal axis. The vertical axis is the standardized effect size of sending an activity suggestion versus no suggestion. And we hypothesized that early in the study, the individual would be beginning to learn about these activity suggestions, so the effect might slowly increase with time. If they get a suggestion, they try the walk. If they don't do anything. But then as time goes on, we hypothesized that the effect would deteriorate. mainly either due to burden or habituation. So what did we find when we ran that first 42-day study? We found that people were very responsive to these activity suggestions in terms of their subsequent 30-minute step count. That is, if they got a suggestion versus if they didn't, they were more active. That effect was primarily due to the higher burden walking activity suggestions. It's very interesting. And as we hypothesized, unfortunately, the effect deteriorated with time. Early in the study, the effect was approximately a doubling of someone's steps over the 30 minutes, which is a really nice effect. But by midway through the study, day 20-21, the increase in step count was minimal. We did a number of exit interviews with participants, and it appears that this was mainly due to habituation. People just didn't see the suggestions after a while. Even though they could never get the same suggestion twice, they just didn't see them. So how did this impact the design of the subsequent studies? Well, the first thing we did was we improved the user interface to try and make the app more engaging. We did add some other intervention components. In addition, we developed an artificial intelligence algorithm that the idea was when there's signs, indications that an individual is starting to become less responsive to a walking activity suggestion, this algorithm should reduce the chance that the individual gets an activity suggestion and allow, therefore, dishabituation. That is, allow the individual to become once more sensitive to the stimuli of a walking suggestion. So this is where we're getting to the next part of this talk. This is the AI part. And I will show you some data from 1 or 2 users in these personalized studies. I call them personalized because in both of these studies, the AI algorithm was being used. So let's just revisit micro-randomized trials. So micro-randomized trials are trials in which each individual is randomized many times. In our case, at any of the 5 times per day, at each of the 5 times per day, it's a sequential experimentation. Now, the randomization probability in the first HeartStep study, the 42-day study, was 0.6. With probability 0.6, the individual would receive a suggestion. However, one could use an AI algorithm, in particular a reinforcement learning algorithm, to personalize that probability. So reinforcement learning, the idea here is that if the individual appears to be being more responsive in a certain setting, then the probability with which that individual would receive an activity suggestion should increase. If the individual appears to be less responsive in a particular setting, as time goes on, then the probability that the individual would receive that intervention in that setting should decrease. So again, I state that again in this second bullet point. Personalization means that if you are more responsive to a type of suggestion in a particular context or state, then you will get that type of suggestion with a higher chance as compared to others. We actually have 2 online algorithms running, but we're going to focus on this RL algorithm here. And the issue, and this RL algorithm, this personalization, is all about when should you deliver an activity suggestion? When should you not deliver an activity suggestion? To recap, the suggestions were these little contextually tailored suggestions that appear on the lock screen of the smartphone. there would be an audible noise and the screen would light up. And we have the example here. They could occur at any of 5 times a day, person-specific times. And the idea was to increase activity over the subsequent 30 minutes. Now, a big challenge, and we've already kind of hinted at, I've hinted at this already, is that these activity suggestions, they tend to have, if anything, a positive effect, increasing step count immediately, that is in the next 30 minutes, but a negative impact on future. That is, as the person habituates or perceives burden of the intervention, they become less responsive. These are delayed negative intervention effects. Now, of course, we would like to have a positive delayed effect. That is, we would like it if people form healthy habits. But the big signal in the data is closer to this negative, the signal of habituation and burden. So we really have to pay attention to this. Also, if people experience too much burden, we're not going to be able to help them. So how does a RL algorithm work? Well, from a statistician's perspective or a behavioral scientist's perspective, there's always 2 elements to every reinforcement learning algorithm. The first element, which is commonly called a learning algorithm, fits some statistical model. And in our case, we're going to use a Bayesian statistical model. And this is a statistical model for the activity suggestion as a function of treatment effect. So it provides an estimate of the treatment effect on the activity suggestion on the individual's subsequent 30-minute step count. So for people who do applied statistics, this is sort of a standard thing. The key here is this Bayesian paradigm allows us to repeatedly update the coefficients as new information comes in on the individual. We get a posterior distribution for the parameters of the estimates of the treatment effect as data increases for an individual. That's the first element. The second element of the reinforcement learning algorithm is an experimentation strategy, and that is, how does the algorithm use that statistical model to decide when to send a message? And this is, since it's a Bayesian statistical model, what we do is we calculate the posterior probability the setting the individual is currently in. We ask, what's the posterior probability that the treatment effect will be positive in that setting? Actually, we add a little bit of a prediction of the chances of a delayed effect. So we calculate the posterior probability for the setting the individual is in right now. What's the posterior probability that the treatment effect plus that little delayed effect, which is, the delayed effect is probably negative, what's the probability that that treatment effect plus the delayed effect is positive? We calculate that probability, and that's the probability we use to send a activity suggestion. So if that probability is high, we're going to send the suggestion with greater probability. So I just want to show you some results. So this is one individual in the study. This is a study that went on in Seattle, Washington, by a large health maintenance organization in that area. This individual has stage 1 hypertension. The horizontal axis is the day in the study. So this individual started in the study in mid-November 2019. The individual ended the study in early August 2020. Just notice that the pandemic really caused a lockdown in Seattle around March of 2019. So that's in the middle of the graph. The vertical axis is the algorithms. The algorithm uses that the learning algorithm gives us a prediction. And the prediction is a prediction of the treatment effect in that individual's current setting. So that prediction can change because the individual, each individual, the time, it might be a different time of the day, they may be at home or work, and in particular, we're color-coding these predictions by whether or not the individual was currently very engaged. So blue means the individual has been looking at the app without us prompting them, tracking their behavior. Red means the individual has not been looking quite as much. And what you see is the algorithm is predicting that the treatment effect is going to be higher when the individual is engaged. And this prediction continues to go forward in time. In other words, the evidence, as evidence accrues, the prediction continues to hold because it keeps getting updated. So what does this mean for the personalization in terms of personalization? What this means is that the probabilities of getting a suggestion also vary according to that prediction. So the blue is the probability of being delivered a suggestion if the individual, this particular individual, was currently engaged, and the red is if the individual was currently less engaged. And you see, indeed, all the blue probabilities are much higher. They top out at 0.8. We weren't going to send more than an average of 80% of the time. And the probabilities, the lowest probability is 0.2. We were always going to send messages with at least 20% of the time. So I want to show you one more slide. So what I did was I took these two and I stacked them on top of each other. This is what we mean when we say personalization. We have an algorithm which is tracking the individual, observes where the individual is at that moment in time, and whether they're engaged or not in this particular case, and calculates a predicted effect of sending the message in that setting. And then accordingly, the bottom where the green arrow is, the probability of the individual getting a message or being delivered a message is associated with that effect. It's higher when the individual is apparently more responsive, has been more responsive in that particular setting, and lower when the individual has been less responsive. I have results for another individual, but I'll skip that in the interest of time. So what's our long-term goal? So our long-term goal is that when a large, in our case in the States, this would be with a health maintenance organization, when they roll out a new app for their patients, say patients with stage 1 hypertension, this application, this digital health application, will have many intervention components: stress reduction, physical activity, healthy eating. And one other component will be RL algorithms. And this algorithm will be used to continually learn, to continually personalize as the individual experiences the app. That's our long-term goal. Okay, I'm going to stop here. And I think my understanding is that questions will appear in the conversation block. I'm not quite sure how that occurs. Thank you.